Did you wake up with neck pain? Did you hurt yourself while doing something simple like blow drying your hair or sneezing? And now it hurts to turn your head in any direction and you're having spasms and sharp pain? If so, this video is going to be good for you. Hi, I'm Dr. Ian Puntney, and today I'm going to talk about neck pain that maybe started out of the blue, out of nowhere while you were doing something at home, and now it hurts to move your head. So I'm going to give you some simple exercises, some simple stretches that you can do to just help you along the path to feeling better and getting better as quick as possible. So what I tell my patients when they come in with this, or maybe they're calling in because they're scared, it hurts really bad to turn their head, I will encourage them to work on maintaining their range of motion. So a lot of times people are afraid to move. They just won't move their head because it hurts. So commonly when people come in, they'll say, I can move my head to the left, but I can't turn my head to the right. It hurts. I get a stabbing pain. Or I can move my head down, but I can't tilt it back. I get a stabbing or a jamming pain there. What we want to continue to work on is maintaining those ranges of motion. So we're actually going to go and move our head into those ranges, even though it hurts. So what you can do is you'll just guide your head. Let's say I can't turn to the right. I'm going to guide my head to the right into that painful range and then come back to neutral. And again, we're just working into that range, coming back to neutral. Working the opposite direction, back to neutral. Back into the painful range, back to here. And you'll notice the more you do it, typically the less it hurts and the better range of motion you have. The same for tilting back. You're just softly tilting your head back, even though it might hurt. And notice the more you do it, typically that range of motion will improve. And that's important. You don't want to completely rest your head and neck when this happens. You got to continue to move. The other thing we want to do is activate the muscles around the area that's been injured. So what I typically will have people do is work on some isometric contractions, which just means we're contracting the muscles against resistance without moving them too much. So for instance, with the head and neck, what I typically will have people do is contract their head into different ranges of motion with resistance from their hands. So I'm just holding my head steady there, and I'm basically doing this motion, but I'm not actually moving because my hand's stopping it. And I'm not using all my strength, but I am contracting into it. And I'll do it both ways. So tilting both ways, we're going to work rotation, so you can contract this way, contract the opposite way. It's good to work on contracting back against restriction, and the same working forward against your hand. And so that's going to activate some of the muscles and typically will help some of this pain as well. The next exercise, which is my favorite for this situation, is called a chin retraction. So what you do, it's super simple. You're just taking your chin, if your chin sits here, and we're going to retract our chin straight back. So I'm not tucking my chin down, I'm not tilting it up in this instance. I am just taking my chin straight back, and I'm doing it repetitively. So I'm going back to neutral, tucking my chin. And you'll notice that yes, it does hurt along the back side of your neck when you do this, but again, the more you do it, typically it'll feel a little bit better and your range will get better. So I recommend my patients do those repetitively. So 10 to 15 times every hour. So I'll have them set a timer on their phone, and every time that thing goes off, you need to sit up and do those exercises to keep those joints moving. Once that feels better, you can actually do that supine or laying on your back. So it's very simple. You're just going to lay on your back, and again, we're just tucking our chin straight down and coming back to neutral. Straight down, coming back to neutral. Same amount of repetitions apply. We're just doing that throughout the day, especially for the first few days after something like this happens. The last thing you can do is you can do some supported traction or extension, mostly extension, and you're going to do that against a hand towel. So you may want a towel a little bit bigger than this, but you're just going to roll it up, put that right behind your neck, and then I'm extending or tilting my head back over it, and I'm just pulling the towel forward slightly. And you'll notice again, like, it hurts somewhat to do, but the more you do it, it seems like you can get some of that range of motion back. So this is a very good exercise. Again, pulling here and going here. So remember, you've got to continue to move. It's good to contract the muscles and then take it through its ranges through the chin retractions and the towel with the extension. And those things alone keeping it simple will help a lot. And the other question a lot of people ask is, do I do heat or do I do ice? Heat's going to make it feel better in the moment, but remember, it just started. Typically, when you're in this much pain, you have inflammation in those tissues, whether it's the joint or the soft tissue like the muscle and the tendons. And so typically ice for the first 24 to 48 hours is going to do you a lot of good as compared to the heat. Now you can add in heat later to help to help relax some of the muscles. And again, it will help you feel a little looser, but we want to manage that inflammation on the front end, and we want to do things that are going to mitigate the inflammation. Ice is going to be much better for you with that. And so what I typically have patients do is ice it 20 minutes, an hour, whenever you can. So if you work from home or during wake hours, if you can just lay on ice or have ice on there for 20 minutes throughout the evening or whenever you get off work. Obviously you can't ice everywhere, but do it as much as you can, 20 minutes on, 40 minutes off. And so those are the simple steps that I work on with my patients. And typically within a few days they're starting to feel normal again. Sometimes it's quicker than that. But usually, like I said, we can get you feeling good pretty quickly. Don't be too scared to move your head through those ranges of motion and your neck through those ranges of motion. It's okay. You just got to keep it moving. It will get better. If you are struggling with neck pain and you would like to have your neck evaluated and treated on the same day, give us a call, 859-309-1996, and we'll do our best to take care of you. Hope this helps, and I'll talk to you soon.